I got my stethoscope, got my pen light, got gloves. I'm gonna be doing my head to toe assessment today. All right, so knock, knock, knock. Open the door. I'm gonna come into my patient's room. Hi there, sir. My name is Lewis. I'm a student nurse at Tarrant County College. I'm gonna be doing a head to toe assessment on you today, okay?
All right.
All right. Can I have your name, please?
Timothy Jocham.
Okay. Do you know where you are right now?
At the hospital.
All right. Do you know what we're gonna be doing today?
Head to toe assessment.
All righty. Do you know today's date?
March 29th, 2023.
Okay, perfect. So at this point, I'm going to do 20-30 seconds of hand hygiene. I'm going to put my gloves on. I'm going to pull my curtain to provide privacy for my patient. I'm going to come over to my patient. I know we went over your date of birth and name, sir, but I just want to check it one more time with your armband. Is that okay?
Yeah.
All right. Can you repeat your name and date of birth for me?
Timothy Jocham, 8/28/72.
Thank you very much. All right. So at this time, my patient's level of consciousness is ANO4, alert and oriented. He's got a pleasant demeanor and affect. His responses seem appropriate and calm. His speech seems appropriate and the answers to the questions that I've asked. At this point, we are going to move on to our visual assessment of my patient, and we'll start at the top of the head. So we're going to start looking at the crown of the head and looking for symmetry. If I see any kind of concerns for patches or lumps or lesions or anything like that along the scalp. So scalp looks good, skin looks intact, pink, warm, dry. I don't see any hair concerns or anything. My patient looks to be groomed and keeping up with personal hygiene. Symmetry looks to be good on left and right hand sides. At this point, I am going to move down and visually inspect the face. Looks to be symmetrical, left and right hand side. Movement while patient was speaking seemed to be bilateral. No drooping or concerns of either side of the face. At this point, I am going to take a look at my patient's eyes. Sir, I'm going to place my thumbs right under your eyelids and pull your eyelids down. Is that okay?
All right.
All right. So gently, I'm going to pull down. I'm going to be checking his sclera. It looks to be white. The conjunctiva is pink and moist. No discharge, no drainage that I can see at this time. Have you ever had any concerns with your eyes, sir? Or any drainage recently?
No.
Okay, perfect. Any vision or blurred vision? Okay, are we nearsighted or farsighted?
Nearsighted.
Okay. Do you use contact or corrective lenses for that?
Glasses.
Okay, we use glasses. All right. So I'm going to check your pupil response with a light. Is that okay?
Mm-hmm.
Okay. So I'm going to flash a light right here, right there, and we're going to flash another light. Okay. My patient's pupils at this time are equal, round, and reactive to light. So I'm going to have you follow the tip of my pen light with just your eyes, okay? And now. I also have accommodation for my patient's eyes. At this point, I'm going to move down to the nose. The nose seems to be symmetrical. I don't see any damage to the external nares. There seems to not be any septal deviation from the external portion of the nose. Are you able to tilt your head back for me, please, sir? Thank you. So I'm going to visually take a look in there. I'm going to shine a light. The mucosa looks to be pink. I don't see any skin damage, lesions, polyps evident. I see no drainage at this time from my patient's nose. Have you been aware of any kind of drainage, sir, from your nose? Thank you. Okay. All right. Have you ever had any surgeries on your nose or any concerns with breathing through it?
No.
All right. Perfect. So at this time, we're going to move down to our mouth. I don't see any cyanosis, bluing, or whiteness around the lips. Lips seem to be pink. Are you able to open your mouth for me, sir? Thank you. I'm going to shine a light in here real fast. Can you lift your tongue for me, please? Take a look under. Can you say ah? Okay. Okay, at this time, uvula seems to be midline. I don't see any swelling or enlargement of the tonsils. The back of the throat seems to be pink and moist. I saw no lesions under the tongue or around the mouth. Are those your normal teeth, sir? Okay. Patient has all his normal teeth, no dentures or implants. Um, do you ever have any difficulty chewing or swallowing food? Any pain in your mouth? Okay. All right. Now we're going to move to the patient's ears. So I'm going to take a look at the right ear first. I'm visually inspecting around and the ear canal, opening of the ear canal. I see no concerns for skin. It looks to be pink, symmetrical. No drainage from the ears at this time. I'm going to do a whisper test on you real fast. Is that okay, sir? Okay, just repeat back what I say.
Hello?
I'm going to go on to the other side. Okay. I'm going to visually inspect the ear again. I'm going to shine a light. No drainage noted at this time. Symmetrical. Skin looks pink, warm, dry. I'm going to do the whisper test on the other side. Okay, sir?
Yep. Good morning.
All right. Perfect. Patient seems to be able to hear fine. Have you ever had any hearing issues recently or in the past, sir? Any use of hearing aids? Okay. At this time, we are going to move down to the neck. So I'm just gonna bring the gown down just a little bit. Alrighty, sir. Can you turn your head left and right for me? Thank you. All right. Can you tilt your chin to your chest? Thank you. And tilt your head back for me. Thank you. Can you touch your right ear to your right shoulder? Thank you. Left ear to your left shoulder? Thank you very much. All right, range of motion for the neck looks very good at this time. I see no deviation of the trachea or jugular vein distension when my patient moves his neck. At this point, we are going to move down to the shoulders and chest. So I'm going to open your gown. Is that okay, sir?
Yep.
All right, I'm going to visually inspect the skin on my patient's chest wall. I see no skin concerns at this time. I see him, as he's breathing, his shoulders are rising pretty equally. Are you able to shrug your shoulders up for me, sir? All right, perfect, thank you. At this point, I'm inspecting rise and fall of the chest, looking for any type of accessory movement of one side or the other, or any type of retractions of the ribs. None of that is evident on my patient at this time. It looks to be a regular, controlled breathing at this point. I'm going to then move on to auscultation of my lung sound. It's going to be 6 points in a zigzag pattern. All right, sir, can you take a deep breath for me? And let go. And another one. And out. Another one. And out. Another one. And out. Another, and out, another, and out. Okay. I heard no adventitious breath sounds listening for auscultation. Are you able to sit up for me, sir?
Yeah.
So I can listen to your back. Would you like a hand? Okay. All right. Well, I'm going to inspect again. Visually, I see no changes to the back of my patient going all the way down. Skin looks pink, warm, dry, intact. I see no movement or absence of symmetry on breathing. So same thing, zigzag pattern, 6 points. Take a deep breath for me, sir. And out. And another. And out. Another. And out. Another. And out. Another. And out. In. And out. Thank you very much. Okay. I am going to physically palpate my patient's back and check again, making sure I feel no abnormalities going down. Okay. Any pain or tenderness on your back, sir?
Nope.
All right, thank you. Lay you back. All righty. At this point, we are also going to palpate the front of the chest. So I'm going to come down and check and feel. I feel no abnormalities, no shifting of the ribs. Everything seems to be symmetrical. Okay. I am now going to listen to my heart sounds. With master cardiology, I don't have a bell. I would just push in a little deeper to be able to hear S1 and S2 effectively. Okay, so we're going to start with our aortic arch, a little bit to the right of the sternum. We're going to listen to our pulmonic arch a little to the left of the sternum. We're going to come down to Erb's point, then come a little further down and listen to the tricuspid. then shift over a little more to midclavicular and listen to our mitral. All right. I heard no murmurs. Heart rate seemed normal. If I did suspect any concerns with my heart rate or any murmurs, I would listen to the apical pulse for a minute, and that would be at the 5th intercostal space midclavicular. Okay. I, at this point, am going to check my patient's pulses for 30 seconds and see if the rate is equal on both sides. Okay, rate seems normal. All right, 30, and I would multiply that by 2 for my full minute for my heart rate. For my lungs, I would also do 30 seconds and multiply by 2. My patient seems to have a normal regular rate, about 16 breaths, non-labored. No retractions, no nasal flaring that is I can see. The heart rate was in the 70s, and that is also a normal rate for our patient. Okay, all right, sir, I'm gonna raise the gown back up on your chest. Clip you closed real fast. All right. Before we move down to the abdominal cavity, I am going to check my patient's upper extremities. So skin is exposed at this time. I see no concerns for the integumentary system, no lesions, no abnormalities. They appear symmetrical, left and right arm. Alrighty, sir, are you able to sit up for me?
Yeah.
All right, perfect. Are you able to raise your arms to shoulder level? Okay, how about out to the sides? Can you circle slowly forward and slowly backwards? Okay, that's perfect. Then you can rest your arms back down. Alrighty. All right, what I'm gonna have you do is pull my hands with your hands. Thank you. And push against my hands. Perfect. Now I'm gonna have you squeeze my fingers. Squeeze, squeeze, squeeze. Perfect. Okay. Grip strength, and it seems to be equal and symmetrical, left and right arm. Alrighty, sir. Thank you very much. I'm gonna have you lay back. I see your hands one last time. I'm going to check your capillary refill on your fingers. Capillary refill seems to be less than 3 seconds, which is a normal finding. I see no abnormalities in the nail beds or nail coloring, no clubbing of the tips of the fingers for my patient. Thank you very much. Okay, at this point we are going to go down and inspect the abdominal cavity. And so I'm going to bring down the blanket to keep my patient modestly covered, and I raise up the gown so we can expose just the abdomen. Okay. I'm going to visually assess the abdomen of my patient. And I do not see any masses. I do not see any lesions, skin concerns. Skin seems to be pink, warm, and dry. Do you have any pain right now, sir, in your abdomen? Okay. Have you ever had, how often do you have a bowel movement?
Twice a day.
Twice a day, alrighty. Any changes in your diet or weight gain? Weight loss, okay. Any concerns with incontinence? All right, perfect. So we're going to auscultate 15 to 20 seconds in each quadrant, starting in the right lower quadrant. Okay. Abdominal sounds are normal active. If they were absent or diminished, I would listen for longer than 15 to 20 seconds. I'm going to start a palpation on my assessment of my patient. He had already stated he had no pain. If you feel pain or tenderness while I'm placing, let me know, okay? Okay. So we'll do a rolling motion, right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Any pain or tenderness? Okay. My patient stated that he had no pain or tenderness. I did not feel any masses or pulsatile sensations. It didn't seem to be any enlarged organs on my palpation assessment. Okay, at this time I do not see any drains or connections to my patient, no IV connected. Do you have any concerns with your urinary area or genitalia? Okay. No burning when you urinate?
Nope.
Okay. How often are you able to urinate?
Once an hour.
Okay, perfect. All right. If I did identify a IV site, I would make sure that it's clean. There's no infiltration noted, no redness. I would keep it as clean as possible with a Tegaderm around it and secure it appropriately with tape or a occlusive dressing. Okay. I had forgotten to ask, so I'm going to ask now. Do you have any lung concerns or history of lung concerns, sir? Any cardiac concerns or history of cardiac concerns? Do we take any medications for either of those? Nope. Okay. Do you smoke or have you ever smoked? All right, perfect. All righty. And we are going to go down at this point and check my patient's lower extremities. So I'm going to raise the blanket up. Expose lower extremities. Okay, so I'm going to take a visual assessment of my patient's lower extremities. Skin seems to be pink, warm, dry, intact. I see no visualized wounds or concerns. Nothing seems to be asymmetrical. Alrighty, sir. Are you able to lift your legs? Alrighty, and lower them back down for me. Perfect. I'm going to check capillary refill on my patient's toes. Okay. Appears normal, less than 3 seconds. I'm going to check for dorsalis pedis on my patient. Pulses feel good, strong, and steady. +2. I'm also going to check for posterior tibialis, and also feels good, strong pulses. Okay, we're going to bring your pants legs back down. Alrighty, sir. Do you think you'll be able to go to a seated position here on the side of the bed for me?
Mm-hmm.
Okay. Alrighty. So we're going to do a strength test first before we walk. Okay.
All right.
All right, so I'm going to push down on your legs. Lift your legs up for me. Thank you. Okay, and then down. Perfect. Forward with your legs and back. Perfect. Same thing with your feet. I'm going to push down, you push up. Okay, and like a gas pedal, push down. Perfect. Okay. Any concerns, pain, tenderness, absence of sensation for your feet?
Nope.
All right. Do you think we can stand unassisted?
Yeah.
Perfect. If you can do that for me now, please. I'm going to have you walk about 5 or 6 paces and then come back. All right. Thank you. Right. You can take a seat on the bed for me, please, sir. Gait seems to be normal. No abnormalities noted. No hitching and stride. Patient walking with no concerns. Did you have any concerns with walking? Dizziness, lethargy, anything like that? Perfect. Okay, I'm going to have you lay back on the bed for me, please, sir. Okay. I knew I missed it at the beginning, but do you have any allergies that you are aware of, sir?
Nope.
Any medication allergies?
Nope.
Seasonal allergies?
Nope.
Environmental concerns for allergies? Allergies to latex or any types of lubricant or tape?
Nope.
All right, perfect. All righty. At this point, I would make sure that my patient is safe in the bed. The bed is locked. Bed is as low as it can go. Bed rails up ×2. Call light easily within reach of my patient, right here. Just push the red button if you need us, sir. And at this point, that is the end of my head to toe assessment. I would take my gloves off, do hand hygiene for 20-30 seconds, and remove the drape. And that is the end of my head to toe assessment.